All right, let's dive into this laparoscopic hernia repair stuff. We got a pretty hefty stack of journal articles here, all about these minimally invasive techniques, and you want us to pull out the key points, right?
Yeah.
Especially the pros and cons of the different approaches.
There's that.
Sounds like you're maybe thinking about getting a repair yourself, huh?
Well, whether someone's facing a hernia repair or just wants to be more, informed, I think understanding the basics can really help them talk to their doctor.
Yeah, that's so true. A little knowledge can go a long way. Okay, so I think a good place to start is with this whole laparoscopic versus open repair thing. Remember when laparoscopic surgery first hit the scene?
Oh, yeah.
It was all like, less pain, a faster recovery. Everyone was like, sign me up. But what's interesting is that initial perception of minimally invasive, it often kind of overshadows like the reality of what's actually going on in the procedure.
It did seem revolutionary. But like a lot of things in medicine, it's not always so simple. Laparoscopic surgery, while it can be great, it's technically very demanding, requires special training for surgeons, and it might not be right for every hernia. What's really surprising is that for straightforward single hernias, an open repair may actually be the preferred way to go.
Wow, yeah. I was surprised by that, too, when I was reading these articles. I guess it's a good reminder that, one size doesn't fit all, right?
Right.
Let's dig into those two main types of laparoscopic repairs you've been reading about. We're talking TAP and TAPP,
Yeah.
totally extraperitoneal repair, transabdominal peritoneal repair. I mean, those are some serious medical terms, even for a deep dive like this.
They are mouthful, aren't they? But the main difference is actually pretty simple. It all boils down to how the surgeon actually gets to the hernia. Imagine you're trying to fix a leaky pipe under your sink. You could go through the cabinet doors. That's like the TAPP approach. You're going directly through the abdominal cavity.
I see where you're going with this. So then what's the TEP like?
The DP is more like if you tried to reach that leaky pipe from behind the cabinet, you're avoiding the stuff inside. It goes around the abdominal cavity. That's why it's considered theoretically safer, because it avoids going into the abdominal cavity directly.
So TEP avoids going through the abdominal cavity altogether? It's like taking a detour to avoid all that traffic, huh?
Exactly.
But if it's that much safer, why wouldn't surgeons always just choose to do it that way?
Well, think about it. Taking those back roads, sometimes it can be a little more challenging to navigate, right? TEP is technically a bit tougher, and there's a higher chance the surgeon might actually have to switch to an open procedure if things get a little too complicated.
So there's that trade-off again. Okay. What about TAPP? You said that's more like going straight through the abdominal cavity. Does that make it like easier for the surgeon?
Generally, yes. It's a more familiar route, so to speak. But we're still talking about some pretty delicate surgery here.
Yeah.
Even with TAPP, there are risks. Like you could have accidental bowel injury or adhesions.
Adhesions. Is that like when my jeans get all stuck together in the dryer?
That's actually not a bad analogy.
Right.
Adhesions are like internal scars that form after surgery, and those can cause problems down the line.
Yeah.
TAPP also has a higher chance of a new hernia forming right there at the incision site. That's what we call an incisional hernia.
So both approaches have their own set of challenges then. It's kind of wild how even choosing the route to get to the hernia is like such a big decision. Really points to how important the surgeon's experience is, huh?
Oh, absolutely. Experience is key. In fact, the research that you've brought shows that even a tiny unintentional hole in the peritoneum during a TEP procedure can lead to bowel obstruction later on.
Really? Wow.
Yeah.
So even when they try to avoid the abdominal cavity altogether, there's still a risk of complications down the road.
Exactly. Just goes to show that no surgery is completely risk-free. But it is worth noting that this specific risk is still less common with TFP than with TATFP.
That makes sense. Okay, so we've talked about kind of the general pros and cons, but our research also pointed out some specific cases where laparoscopy really seems to shine. Bilateral hernias, recurrent hernias, and femoral hernias, they all seem to benefit from this minimally invasive approach. And it makes me wonder, is there like an ethical thing here, promoting a surgery as minimally invasive when it's clearly so complex and comes with all these risks?
That's a really interesting point.
Yeah.
It's definitely something to think about as we continue this deep dive.
Yeah.
Laparoscopy really does excel on those more complex cases, and that's because it gives surgeons a much better view, especially in areas that are harder to reach. For example, with recurrent hernias, particularly after an open repair, the laparoscopic approach lets the surgeon work in a different tissue plane.
Tissue plane, that sounds pretty technical. What does that mean?
Think of it like different layers of tissue.
Okay.
With laparoscopy, surgeons can actually avoid disrupting the areas that were operated on before. You're minimizing further damage.
So it's like taking a new route to get to that same destination, avoiding those roadblocks from the previous trip. And speaking of experience, our research mentioned that surgeon experience is especially important in these more complicated cases.
That's right. The data shows that less experienced laparoscopic surgeons tend to have higher rates of hernia recurrence. So if you're dealing with a more complex hernia, it's even more crucial to find a surgeon who's really skilled in these laparoscopic techniques.
It's a good reminder that experience really does matter. And maybe even a stronger argument for carefully evaluating how we define minimally invasive. Now, speaking of specific considerations, our deep dive also revealed some interesting challenges when it comes to hernia repair, specifically in women. I was surprised to learn that groin hernias are less common in women, but they often present some unique challenges.
Yeah, it's true. While less common, they can be harder to detect early on in women because of anatomical differences. And unfortunately, that means that more cases present as emergencies require an immediate surgery.
That's kind of concerning. What makes them so difficult to detect in women?
Well, in women, the area where most hernias occur, that's called the inguinal canal, it's just more difficult to examine physically. So it's easier to miss those subtle signs of a hernia developing.
So early detection is a challenge. What else makes hernia repair unique for
Yeah.
women?
Femoral hernias, which are located a little lower down in the groin, they're actually more common in women. And another type called indirect hernias, which travel down the inguinal canal, they tend to be more attached to the surrounding tissue. This can make the TAVI procedure particularly challenging.
So not only are they harder to detect, but the actual repair can be trickier too. What's even more concerning is that research shows women actually have a higher risk of hernia recurrence even after repair, and that's regardless of the technique used.
Unfortunately, yeah, that's something we do see. It's still not totally clear why this is the case, but it definitely underscores the importance of meticulous surgical technique and long-term follow-up care for women who have hernia repair.
It also kind of raises the question of whether enough research is being done to address this specific challenge for women. It's like we're really quick to label something minimally invasive, but maybe not so quick to investigate the long-term implications for different patient groups. But for now, I think it's time to address the elephant in the room, potential complications. No surgery is completely without risk, right?
Absolutely not. And while we've been focusing on the potential benefits of laparoscopic repair, it's it's essential to understand that complications can and do happen.
Yeah.
And the research that you've brought highlights a number of those potential complications.
Okay, lay it on us. What are some of the potential complications our listeners should be aware of?
One that really stands out is chronic groin pain. This pain can persist even years after the surgery. Some studies actually show that it occurs in as many as 8% of patients 2 years after their procedure.
8%. That's a lot of people. What causes that long-term pain?
Well, it could be a few things. You could have nerve damage during the surgery, maybe inflammation, or even the mesh itself.
Yeah.
Sometimes it's really difficult to pinpoint the exact cause, which makes treating it all the more challenging.
Yeah. It seems like that promise of minimally invasive starts to break down a little bit when you're potentially facing years of chronic pain.
You're right. Minimally invasive doesn't always equal minimal risk.
Right. So it's not just about that initial recovery period. There's the potential for these longer-term issues as well. What other complications should we be thinking about?
Another concern, and this one is particularly for men, is testicular pain. Remember how we were talking about that spermatic cord and the need to carefully separate it from the hernia sac?
Yeah.
Well, if the blood supply to the testicle is compromised during this process, it can lead to pain, inflammation, and even testicular atrophy.
Ouch. That does not sound good. How often does that happen?
Thankfully, not as often as the chronic groin pain, but it does occur. About 1.4% of laparoscopic hernia repairs will result in this complication.
Okay, that's still something to keep in mind, especially for guys considering this surgery. Are there any other complications specific to men that we should touch on?
Yes, actually. There's a potential for injury to the vas deferens, which is the tube that carries sperm from the testicles.
That sounds pretty serious, especially for younger men who might want to have kids someday.
You're absolutely right. It is a significant concern. Thankfully, it's pretty rare, happens in less than 1% of cases. But again, just really highlights how important that meticulous surgical technique is. Now, shifting gears a bit, there are complications like seroma and hematoma formation, and those can happen to both men and women.
Seroma and hematoma formation? I'm not really familiar with those terms. Can you break those down for us?
Sure. So a seroma is basically a collection of fluid that builds up under the skin, and a hematoma is a collection of blood.
Okay.
And both of those can cause swelling, pain, discomfort.
So basically, pockets of fluid or blood that form around the surgical area. Our research mentioned that they occur in about 5% of laparoscopic hernia repairs. Are those usually serious?
They can be, depending on their size and location. Sometimes they go away on their own. Other times they need to be drained or even require another surgery.
Oh, okay. So definitely something to keep an eye on. What about infection? That's got to be a concern with any surgery, right?
You're right. Infection is always a concern. But the good news is that the rate of mesh infection after laparoscopic hernia repair is actually lower than with open repairs.
Yeah.
It's less than 0.2%.
Oh, wow. That is good news. Are there any situations where the infection risk might be higher?
Yes, there are. Things like a larger hernia, diabetes, obesity, or a weakened immune system. All those things can increase the risk of infection.
So it seems like there's a lot of factors that patients and surgeons need to consider when weighing those risks and benefits of this procedure.
Hmm.
What about mesh migration? Our research mentioned that as a potential problem as well.
Ah, yes. That's another important one to discuss. So mesh migration, it basically means the mesh, which is supposed to be staying securely in place, it moves from where it's supposed to be.
And that can cause problems, I imagine.
It can, yeah. It can lead to pain. The hernia might come back. You could even have the mesh eroding into surrounding organs.
Oh, wow. That's not good. How often does that happen? Mesh migration?
It's not super common, but it does happen.
Yeah.
And it can have some pretty serious consequences.
So we've covered a lot of ground here when it comes to potential complications. I just want to make sure our listeners understand we're sharing this information not to scare anyone.
Right.
It's about empowering you with knowledge.
Exactly. We want you to go into any medical decision with your eyes wide open, understanding both the potential benefits and the risks. That's really crucial.
And I think it goes back to that point we raised earlier about the ethics of calling a surgery minimally invasive. It's so important to have that balanced perspective. Now, before we move on, there's one more pointed debate in the research that I think is worth bringing up. It's the question of mesh fixation. To tack it down or not to tack it down? That is the question.
Ah, yes, the great mesh fixation debate.
Right.
It's an ongoing discussion in the surgical world about whether the surgeon should physically attach the mesh to the surrounding tissue or if it's okay to just, leave it loose.
Okay, I'm all ears. What are the arguments on each side?
Well, the folks who favor no fixation, they say it leads to faster surgery, lower cost, and potentially fewer nerve-related complications because you're not using those staples or tacks.
So less is more, in their view. What about the other side?
Those who prefer fixation argue that it's really important to keep that mesh from migrating, which can lead to all those problems we were talking about. They'll use staples, tacks, or even surgical glue to secure the mesh in place.
So it's like this trade-off between, maybe some benefits in the short term, like a faster surgery,
Right.
versus the risk of long-term complications if that mesh decides to move around.
Exactly. And unfortunately, there's no clear consensus in the medical community about which approach is best.
Really?
It often comes down to the surgeon's experience, their preference, and their judgment
Yeah.
based on, the specifics of each case.
It seems like we're seeing a theme here. A lot of this really comes down to that individual patient and the surgeon's experience. I think it's time to take a deeper dive into some of those individual considerations. Okay, so we've seen that there are a ton of factors to think about when it comes to this laparoscopic hernia repair. And it doesn't seem like there's a clear-cut answer to a lot of these questions, all right? But let's switch gears for a second and talk about what this means for you, the listener. Why should you care about all these technical details?
Well, that's a great question. I mean, it's easy to get bogged down in all the medical jargon and, surgical techniques and all that. But I think the main takeaway here is that understanding the basics really empowers you to make informed decisions about your health.
Exactly. This deep dive, it's not about replacing a conversation with your doctor.
Right.
It's about, giving you the tools to ask the right questions and to, have that real dialogue with your healthcare provider.
Think of it this way. We're kind of giving you a roadmap to navigate this sometimes pretty complex world of hernia repair.
I like that. A roadmap. So, armed with this roadmap, what are like some key questions that you might want to ask your surgeon?
Well, I definitely start by asking about their experience with both laparoscopic and open repairs. You know, how many of these procedures have they done? What are their success rates with each technique?
Yeah, that's a good one. Experience really matters, as we've as we've learned. What
Don't be
else?
afraid to ask them to walk you through the specifics of each approach too. TAP versus TAP.
Yeah.
Why do they think one's better than the other in your specific case?
It's all about understanding, like the reasons behind their recommendations, and of course you're going to want to discuss those potential complications in detail. What should we be asking about those?
Ask them about the likelihood of each complication actually occurring, how those risks apply to your specific situation, and what steps have they taken to minimize those risks.
These are all such good questions to have in your back pocket when you're talking to your doctor. I think this whole conversation has really shown how important it is to be an active participant in your own healthcare.
Yeah.
You know, it's not just like blindly following doctor's orders.
Yeah.
It's about working together, to make those informed decisions.
I couldn't agree more. And remember, this deep dive, it's just, just a starting point.
Right.
If you're facing a hernia repair, take the time to do your research. Look for those reputable sources of information. And don't hesitate to get a second opinion, if you feel like you need to.
Solid advice. Now, before we wrap things up, I want to circle back to something you said earlier about the ethics of calling a surgery minimally invasive. It seems like that term gets thrown around a lot these days, but maybe we need to be a little more critical about what it really means.
Totally agree. It's a term that can be kind of misleading, while laparoscopic surgery can have those advantages like smaller incisions and a faster initial recovery. It's still a complex procedure.
It's got potential risks and those long-term complications that we were talking about. I think it's important to just have that balanced perspective, not oversimplify things.
Well said. I think that's a perfect note to end this deep dive on. A huge thank you to you, our expert, for sharing your insights and expertise today.
It's been a pleasure. I always enjoy, diving into these fascinating topics.
And to you, our listener, thank you for joining us on this journey. We hope you found this deep dive, informative and empowering.
Absolutely. We're always excited to explore new topics, uncover those hidden gems of knowledge. So until next time, keep those brains buzzing.
Man, we've really gone deep on this laparoscopic hernia repair stuff, from the I guess the initial hype around minimally invasive techniques to the more realistic view of just how complex they can be. What about you? I'm feeling way more informed. Yeah, it's been quite a journey. We've looked at the different types of repairs, the pluses and minuses of each one, those special things to think about for women, and of course all those potential complications that could pop up. Really pretty thorough exploration, I think.
And we've really kind of poked at that whole minimally invasive thing, haven't we? I mean, it's a catchy term, but maybe it doesn't tell the whole story.
Right. It's a good reminder that, any medical procedure, even the fancy new ones, they all come with their own set of, benefits and risks. And the important thing is having all that information so you can make those good decisions.
Couldn't agree more. So as we wrap up this deep dive, what would you say is the most important thing for our listener to walk away with?
I think it boils down to the power of knowledge and just being open with your doctor. The more you understand about your options, the better you'll be able to, have those conversations with your healthcare team.
Yeah. Be an active participant in your own healthcare, not just, passively taking in information.
Exactly. Don't be afraid to ask questions. Advocate for yourself. Make sure you understand, what's going on with the procedure, the potential risks, the alternatives, all that stuff before you make any big decisions about your health.
That's such great advice. And that's really what this whole deep dive was designed to do, give you that information and that confidence. So we hope it's been helpful.
It's really just the beginning, though, right?
Yeah.
There are so many resources out there to help you sort through all this. Talk to your doctor, get those second opinions if you need them, and, keep doing your own research. Find those good sources of information.
Absolutely. It's been such a pleasure exploring all this with you. Your insights have been so valuable.
The pleasure was all mine. I always love these chances to share what I know and get into these great conversations.
And to you, our listener, thanks for joining us on this deep dive into the world of laparoscopic hernia repair. We hope you found it informative, empowering, all that good stuff. Until next time, stay curious and keep on exploring.